Hi, Dr. Dennis. I have a few questions for you. I am missing teeth on one side because an old bridge I had broke, and they had to pull all my molars. I would like to chew on that side again. How can dental implants help me?
This is a question and a situation that I get a lot. When you have a bridge and a cavity starts to form under the bridge, then what happens is when it's time to fix it, a lot of times you take the bridge off and the teeth are completely decayed and destroyed underneath. Now, bridges are the old way of fixing the fact that you have a missing tooth. So a lot of times in the olden days, we were cutting down teeth that were next to other teeth and shaving them down in order to replace a tooth. Now, years later, as they decay, we have nothing left. And a lot of people just don't have any molars on that side. So what dental implants do is they now to restore you back to what you should have had before. So now if you lose all your molars, what happens is you're starting to chew only on one side. And I have this discussion, especially when it pertains to dental implants with my patients a lot. Listen, if your mouth is chewing mechanically only on one side, what's going to happen to that side? That side is going to break down faster and those teeth are going to suffer. So that's how dental implants can restore the balance on both sides of your teeth. So we need teeth to chew on both sides. Same thing goes with front teeth. People have only chewing on the front teeth because they have no molars, and then those teeth break down quicker. So things that you could have had for another 20 years now start to break down. You get cavities, things start to decay, and that's because you don't have balance. So dental implants, what we do is we can do a implant bridge, and an implant bridge means that we place a dental implant here, a dental implant here, and a tooth in the middle. So you have 3 teeth sitting on 2 dental implants. And I have other videos to show you exactly what that looks like, but it's wonderful. Now you get to chew on both sides equally. Now, the reason that a partial denture is not the best option to replace that is, think about it, and I'll show you this in another video with models. If that front tooth that's holding up those teeth on the partial is always getting hit on, guess what's going to happen to that tooth? That tooth is going to break too. And so now what do? Move on to the next tooth. Then that tooth breaks off. Then it keeps going, because a partial denture, dentures in general, are not very good at chewing. Even though cosmetically they make things look full, they don't chew the same way as a dental implant would chew. They don't chew the same way as your teeth would chew because it's not anchored to a root, it's sitting on your gums. So when you have dental implants like that, that is as close to nature as you'll ever get again. You have roots, which is the implant. You have a crown that goes on top of the, or implant retained crown, and it's nothing. I have dental implant myself. I always tell my patients, I never think about it because it's like a part of me. It's not something that you have to be aware of, that you have to take this thing on and off. The implant now becomes a part of your regular smile. And that is such a wonderful day. It's a new day in dentistry. There's no need for bridges anymore. We can restore the tooth that is broken with a dental implant without affecting your other teeth.
I also wear a partial denture that I have to take on and off. I'd like to get rid of that too. What can I do?
Partial dentures. They're probably one of my least favorite things to deal with. I make partial dentures, but I think partial dentures are more of a temporary solution. I have people who have worn partial dentures comfortably for many, many years. But do you know what they do? Ever so often, one of those teeth break down, and again, they go to the next tooth. Then the tooth breaks down again, then they go to the next tooth. It's a continual process. So if you want to get rid of that partial denture, you want to take that thing out and never have it again, dental implants can help, because what they do is, instead of having one rim of teeth that has little spots where all the different teeth go, we can put teeth in that spot. It is a life changer. Dental implants will change the way you chew. They will change the way you eat. They will change your social life. They will change your marriage, because at that point, you're not taking this thing off and putting it in a cup. You're not taking it off to chew properly and then popping it back in at dinner with your friends or at a family gathering. You don't have to be conscious of it. It's just in your mouth. So when a dental implant is in your mouth, it's like you. It's not some foreign object that you have to put in your mouth. Again, I make partial dentures. They work for certain people on a budget. But sometimes when you are dealing with something that you cannot wear comfortably, what is the point? I have times where I have a patient say, well, Dr. Denis, I can't afford a dental implant. I said, but can you afford to wear something that you don't like? Because same thing goes with a lower denture, that you have two implants that hold it into place. If I make you a lower denture without implants and you don't wear it, what is the point? Why do you even have that denture? I can't even tell you how many times I say, oh, I have a lower partial, I don't wear it. So you paid for a lower partial and you don't even wear it. Or I had a patient, which is very interesting. She used to take her denture out every time she ate because she couldn't eat properly. So if you're taking it out every time you eat, again, what is the point? Get something that works for your life. Don't get concentrated on what happens in the dental chair. Get concentrated on that wedding, that family gathering, that now you don't have to think about your teeth. I always say the best dentistry is the kind of dentistry you're not thinking about it. Oh, it's just a part of me. I don't even think about my tooth. If you're thinking about your tooth, there's probably something wrong. You want something that's comfortable, that you can chew in, and that's what a dental implant can restore to you.
I have had a lot of dental work done in the past, and now I have to do some again. How are dental implants different?
It is my philosophy that we do things that last. When I meet a patient and we're talking about what they need, in my mind, I am going into the future. I'm going into the future to see what is going to happen in 10 years. I'm going into the future what's going to happen in 20, 30 years. So even though I meet a 25-year-old, I say to them, listen, if you don't get your cleaning done the right way, if you're not regular with your cleanings, you're eventually going to get gum disease. And when you get gum disease, you're going to lose your teeth and end up in a denture. When I meet someone who has had a bridge, or they say, well, I just want to get a bridge instead of a dental implant, I tell them, well, if you get that bridge now, that is something at some point you are going to have to redo. An implant does not decay. An implant is not something that you're going to have to keep revisiting. So even though we think about the money now, and money is important, believe me, I work with most of the patients I see are on some sort of budget. Or even if they aren't, they don't necessarily want to shell out the cash all at one time. And that's what we use financing for. But when you're going to get an implant, you have to think, am I going to have to keep coming back to the side again? Oh, that bridge has to be redone. Oh, that crown that has to be redone. Oh, that root canal that broke, patched it back together, has to be redone. Now I have to go to a specialist. Now I have to do that. That's not something you want to redo. We have 32 natural adult teeth, correct? We have 32 natural adult teeth, 20 as kids, right? And once we get them, we're not going to get them again. We get rid of the wisdom teeth, that's 28 teeth. Now, at that point, if we think about redoing teeth over and over again, you want to get something stable. You want to get something that you don't have to redo over and over. Forget that side. Let it be done. I always tell my patients, listen, I don't want to do work on you over and over. I want you to come in. I want you to get all cleaned up. I want to be proud of the work that you've done. And then I want to say, off to get your cleanings every couple months. But we want to make things that last. We don't want to redo things over and over. I meet patients from other offices and I say, why'd they do that? And patients don't even know why. They just listen to the doctor. I don't even know why I got what I got. I just listened to the guy. But I said, did we think about the future? Did we think about what's going to be coming down the line? Or we just did something immediate? Again, I work with people in all kinds of different budgets. We try to make the right thing work for you, not just whatever works. We need to make the right thing work for you so you can have dental work that lasts, dental work that makes your life work. So that's really our goals, to make stuff that lasts and make stuff that works for your everyday life. for all your eating, all your smiling, all your social interactions, all your working, all your chewing. You want things that work and things that last.
Thank you, Dr. Denis.